COVID kind of hit rural communities a little bit later than the urban areas last year, but once they hit those communities, they hit them hard.
Rural America making up about 15% of the nation, but these areas are outpacing metro areas for COVID deaths.
Yeah, the Delta variant has shown rural communities are at a high risk, and much of that is because of geographic disparities.
Fox 59's Birchelle Evme continuing her series finding out how this health disparity affects rural Hoosiers.
COVID-19 is killing rural Americans twice as much as their neighbors in urban areas. It's the latest data from Rural Policy Research Institute. Sadly, thousands of Hoosiers face the same rural health disparity. Purdue classifies 33 of Indiana counties as a rural mix and 41 as rural. A recent report found most of the state's hotspots are in these rural communities.
Many of these issues have existed for a long time in rural communities, and so these are systemic healthcare problems that need to be addressed. But they would have helped us to fight COVID if we had addressed them before.
Experts we talk with say at least 3 of these issues lead to Indiana's rural health disparities. One of them is a lack of healthcare staff, especially in primary care.
We've seen this in studies that if people have a relationship with a doctor they trust and have been able to talk to that doctor, they're much more likely to get vaccinated.
But the Indiana Rural Health Association found
access to a provider is a limitation. The only other area, or one of the other areas that an individual may look for information, is social media. And unfortunately, what we're seeing on a lot of our social media platforms is misinformation about the pandemic.
It's really unfortunate.
Dr. Emily Backer says misinformation is the biggest challenge in the pandemic.
I've had a lot of conversations as a primary care doctor with people who are not vaccinated and tried to explain the data to them, tried to explain the risks. And, for some people, it's just, a blank wall. There's no convincing them.
Dr. Backer works for the health department in Howard County. Regan Streif Institute considers Howard County one of 10 rural COVID hotspots with more hospitalizations per capita than urban areas. As of mid-October, the Indiana State Health Department reports nearly 50% of the eligible population there was fully vaccinated. It's 60% in nearby urban metros, Marion County, and 80% in Hamilton County, both larger than Howard. Like other communities dealing with high COVID numbers, Howard County faces a second geographic disparity.
Lack of access to the internet can be a barrier because we've seen with healthcare now with COVID, there was a lot of telehealth activity, for example. Well, if you live in a rural community and you don't have broadband internet, you cannot connect to those providers remotely.
Without dependable internet for telehealth, many rural Hoosiers are forced to find an open healthcare provider, which requires a vehicle.
Transportation issues continue to grow in a negative trend, unfortunately.
It's a third rural health disparity.
You don't have transportation, then you're essentially cut off from the healthcare system.
Most rural Hoosiers won't find public transportation to travel for
things like testing, COVID testing facilities, COVID vaccine options, and so really the health disparities that we saw pre-pandemic were just simply exacerbated.
Lack of healthcare staff, internet access, and transportation all contribute to rural health disparities. But COVID-19 has doubled down on just how serious these issues are for rural Indiana's health. Reporting, I'm Birchelle Evme.
Now, Birchelle also asked state health leaders how they plan to address these issues in rural Indiana. You can go to fox59.com right now to see the newest $250 million effort to bring internet access to these communities. Plus, you'll also find her previous report on racial health disparities as part of this series. Now, next week, Birchelle will bring us the final piece in her series.
Well, I've been over here 42 years on the west side, and I've never seen a CVS or a Walgreens or no type of pharmacy.
Fox 59 is going to explore another geographic health disparity, one impacting dozens of Indiana counties. We're talking about pharmacy deserts. Make sure you tune in next week for that report.